A healthcare management intervention example about improving medication adherence through patient education. Medication non-adherence is a significant issue in healthcare, with studies estimating that around 50% of medications for chronic conditions are not taken as prescribed. This results in poor health outcomes, increased hospitalizations, and higher medical costs. One healthcare organization sought to improve medication adherence for patients with chronic illnesses through an intensive patient education program. The aim was to increase proper medication adherence in elderly patients with chronic conditions like diabetes, high blood pressure, and high cholesterol. Proper adherence was defined as taking medications as prescribed over 80% of the time. The goal was to improve adherence from a baseline of 50% to over 80% for program participants after 1 year. The target population was chronic disease patients over age 60 with a history of suboptimal medication adherence, defined as self-reported adherence below 80%. These patients were identified by providers as having difficulty managing medications based on factors like missed refills, uncontrolled symptoms, frequent hospitalizations, and lack of progress at visits. The program sought to engage 150 patients in the first year. The intervention was a group patient education program focused on medication self-management skills. Patients attended 6 weekly 2-hour classes led by nurses and pharmacists covering topics like understanding prescription instructions, setting up pill organizers, managing refills, involving family/caregivers, overcoming side effects, lifestyle factors that influence treatment, and communicating with providers. Classes used demonstrations, worksheets, discussions, and problem solving. Participants received tools like weekly pill organizers, reminder charts, medication lists, and blood pressure logs. Nurses called patients twice a month for 3 months after the classes to provide support, reminders, and answer questions as patients implemented what they learned. Informational handouts were also mailed to patients' homes as refresher tools. Leadership approval. The VP of Quality and the Chief of Geriatrics approved and sponsored the program. Interdisciplinary team, nurses, pharmacists, providers, health educators, and care coordinators collaborated to design and deliver the program. Staff education, nurses and pharmacists attended a 2-day train-the-trainer workshop to learn how to best teach self-management skills. Participant identification and recruitment. Providers used EMR data and records to refer eligible patients who were then contacted by mail and phone. Accessibility. Classes were offered in the mornings and evenings with transport assistance available to improve accessibility. Materials development. The team created class presentations, handouts, tip sheets, logs, and other engaging education materials. Space coordination. Leadership secured training space in a community center near the target population. Budget. Funding was allocated from the quality and education budgets to cover staff time, materials printing and mailing, space rental, transport for patients, and phone outreach. Workflow integration. Staff scheduled dedicated time for the classes and follow-up calls as part of their regular workflow. Pre-post knowledge tests assessed learning. Medication adherence was measured through pharmacy refill data, pill counts, and patient self-reports before and after the program. Readmission data was tracked to identify impact on outcomes. Patient and provider satisfaction surveys were administered. Monthly meetings allowed the team to review data and make any needed program adjustments. 164 patients enrolled and 145 completed the program in year 1. Knowledge tests showed a 63% average increase in medication self-management knowledge. Self-reported medication adherence increased from a baseline of 51% to 88% post-program. The yearly readmission rate decreased by 22% for program completers. 97% of patients said they were very satisfied with the program. Providers reported increased patient engagement around medications. This hypothetical example demonstrates how an intensive education program focused on medication self-management skills could successfully improve adherence and outcomes for chronic disease patients. While fictional, it illustrates realistic components of healthcare program design, implementation, and evaluation. The principles could be applied to create other impactful interventions.